Hello and welcome back to the Hindustan Times podcast. I'm your host Shashak Matu, reporting to you from Washington, D.C. One of the most interesting stories in US politics over the last couple of decades has been the rise of Indian Americans. From barely any political representation 3 decades ago, we've now had Indian Americans serve as Vice President of the United States, as senators, as congressmen, and now we have someone who is running to be the only Indian American governor in the United States. That is Dr. Nirav Shah, who's running to be the Democratic nominee for the governor of Maine. Dr. Shah, thank you so much for joining us here on the Hindustan Times. I'd love to get into talking about your political journey. You've been a doctor, you've been a lawyer, you're now running to be the governor of a state. Of course, you haven't had elected office so far. So I'd love to talk to you about your journey, your career so far. Also, what your reflections on being an Indian American politician right now in the United States. So let me start with this. As I said, you've been a lawyer, you've been a doctor, you've also been most famous for your performance during the COVID-19 pandemic. Could you tell us a little bit about your journey, how you decided to move through these careers, and now you're running to be, as I said, the only Indian American governor in the United States right now?
Well, first, thank you so much for having me on, Shashank. It's a real pleasure and an honor to be able to chat with so many people across the globe. And what has really been the defining aspect of my career, the thread that runs through all of the things that I've done, has been a call toward public service. I started my career in the private sector working as an attorney. However, after a number of years, I really felt the call to do more and address bigger policy issues that were facing our country, in my lane, specifically in healthcare and public health. And so I became the director of the health department in Illinois in very early 2015 and served in that role for about 4 years. And once you see the impact that you can have in public service, it's very difficult to go back to anything else. And so I was then asked to move to Maine, where I live and have been living very happily, and to continue working and running the health department. As you mentioned, when COVID-19 hit, that took a difficult job and made it even more so and more important. But at the same time, the difficulty increased. The impact that you could have on day-to-day lives also became so much more important. Following that, I was asked by the Biden administration to go down and help run the US CDC. I was the number 2 official at the US CDC, and then ultimately wanted to come back to Maine. And so my family and I moved back, and I was approached by some groups to consider leading not just the health department, but the entire state. And again, that desire for impact and to help people's lives is what continues to motivate me then and now.
Right. I could ask you a little bit about just what your reflections have been. As I said, should you be elected governor of Maine, you will be the only Indian American governor at this point in time elected to head a US state. It's been a while since we've had an Indian American in this position. What are your reflections on that sort of journey? How does your background, your connection to India, if you could tell us a little bit about that, where your family comes from, and how that affects how you think about your life, your work, and your politics now?
Well, thank you. And that is part of the story. In the following way, my mother and father moved to the US in the early mid 1970s. They first moved to Chicago and then to the US state of Wisconsin. And I was born in rural northern Wisconsin. And that's when I grew up. Wisconsin is very similar to Maine. And that's why when the opportunity to move to Maine arose, I thought, well, that's very similar to my childhood. But your question about the connection with all of this to my Indian American roots is essential, because I think many of the experiences that I had as a child, navigating different cultures and appreciating the best of both cultures, that sticks with me now. And I say that in the following way. One is, I think it's important for folks to have exposure to as many different cultures as possible. But number two, when you grow up navigating these different cultures, it becomes second nature to talk to folks who don't necessarily have the same background and upbringing as you. It's not a skill that you have to learn. It's just what you do when you grow up in a multicultural family, as I did and as so many others have. And so what that means is that there's no one I can't walk up to, strike a conversation with, and start talking with. The other aspect that is really critical in this moment is representation. Representation matters. And I think it's important in the United States and frankly around the globe for South Asians, minorities of all stripes, to see leaders stepping up, because if we can do it, then we may inspire another person to do the same.
Right. Can I ask you, in terms of, before we get into the meat and bones of, what you're running on and why you're choosing to run for governor of Maine, can I ask you, is there any part of your Indian heritage that you still keep in touch with? Perhaps the movies that you watch, the languages that you speak, something that keeps you in touch with India in your day to day?
Well, yes, in some very direct ways, and then one very indirect way, or perhaps unexpected way. In the direct ways, I still have a lot of family in India. Most of my mom's side of the family originated in Gujarat. Many of them still live there, but of course, now many live in Mumbai and elsewhere. And we have very lively WhatsApp groups that still continue to this day. Some of them thought, well, yes. So that's that connection, that very familiar connection and familial connection remains very, very strong. And I love catching up with them. One of my uncles in Mumbai is an avid follower of politics around the globe, and so he has very keen analysis, not just on what's happening in India, but also elsewhere in the globe. And it's always a pleasure. The somewhat unexpected way that I maintain a very strong connection with India is through the chess scene. Of course, India has led the way in some of the top chess players in the world, going back 30 years with Anand. But now, of course, there is a younger generation of younger Indian chess players who are very, very much among the best in the world and have the potential to be some of the finest chess players that the world has ever produced. And it gives me a lot of pride when I look at their games and see the heritage that they've come from. So India, once again, is leading the way on the chess world.
Right. And you're a chess player yourself.
I grew up as a chess player. I don't have the time to play as much as I used to. Who does? But I still follow it. And it's with great pride that I see the amazing strides and progress that a lot of the young Indian players are making.
Right. And of course, you probably don't have the time to play because you've been extremely busy these last couple of years. And I want to talk about that, which is that you're a doctor by training. You're now heading in to run a US state. You haven't held elected office before in the US. Tell us a little bit about that. How does a practicing doctor decide that he wants to become a politician?
Well, to be truthful, most of my background, even though I went to medical school, has really been in epidemiology and public policy. Again, I went to medical school, but my interest had always been in the public policy side of things. And so immediately after graduating from medical school, I joined a firm that focused on healthcare policy and law. And then, as I mentioned, joined and ran the health department in Illinois. And so even though I started in the private sector, I quickly shifted to the public sector. And that has been my love and my passion. I've always sort of felt that although the patient in front of you was important, I was always worried and wondering about the 1,000 patients who never even found their way to the clinic door. What could we do about them? How could we prevent them from getting diabetes rather than treating them when their situation was acute? And that's why I've always been so interested in the policy aspects of healthcare. Now, going from running two health departments and then being the deputy at the US CDC to then coming back to Maine and vying for political elected office is not as big of a leap as I think you might think. And here's why. Fundamentally, the jobs that I have had have been about running very big things in the executive branch of the United States. Big health departments with thousands of people in times of stress, in times of crisis. That has really been what my career has been about for the past 11 years now. And to go from that skill set to then running the entire state is, of course, a jump. But the core of what it means to be governor is to run a very big thing that's very complicated, often in times of crisis. And that's what I have done for the past 11 years. It just so happens that the way that you go about getting that job is through the electoral process, not the appointed process. But the core skill that you need is management and leadership of a very big thing, often in times of stress. And that is what I have done for the past 11 years.
Right. Could I ask you a little bit about just the setting that you find yourself in, right? Like I said, when I introduced our interview with you, 30 years ago, you barely saw Indian Americans in elected office, even 20 years ago, let's just be honest, right? And now there's an entire slate of candidates. We've had, of course, Zoran Mamdani, Indian origin, just get elected mayor of New York City. We have Ghazla Hashmi, who just became the lieutenant governor of Virginia. We have you running to be a governor of Maine. What changed in the last 20, 30 years? Because I'm asking you also, of course, the story of your life in public service, which is that things just changed. We began to see Indian Americans much more in elected office, thinking that they could, in fact, become elected leaders in the United States. What happened?
I think a few good things have happened. Number one is with any diaspora community, after it gets established, it goes from just the commercial elements of their work into more public service. And I think that's a pattern we've seen in places where there have been South Asians for even a longer period of time. In other diaspora communities. So in a sense, it's not atypical. It's just the maturation of the South Asian diaspora community in the United States. The second, however, is that many of us recognize that we are in a special moment, a moment where the rights of minorities and brown people of all types, not just South Asians, are coming under attack. And frankly, we need to step up. Now, not everyone can step up, but I think everyone can do something. And that's the ethos that I've been sharing with other South Asians around the country. So I think in this particular moment, where many minority groups and brown people are coming under threat or fearing of being scooped up by agents, things of that nature, the one thing that I can do is step up and try to lead. And that's important at the state level because in an era of RFK and Trump attacking people, the way in which our health, our welfare, and our safety will be protected will be at the state level through state governments and the governors who lead them.
Right. And of course, you're running to be governor of Maine, which is a small northeastern state. You're, of course, also referring to the policies of Robert F. Kennedy Jr., RFK, when it comes to, health policy. I wanted to get into what it means to be running against the Trump administration at this point in time. But could I also ask you something you mentioned earlier, which is that something that folks in India have been saying with a great deal of concern is what they see every day online, which is that the number of racist attacks, frankly, against Indian Americans, Indians in the United States more generally have really seen a sharp uptick. And people are unable to understand how the United States went from a country that, just a couple of years ago was considered to be open, fairly accepting. Of course, any country has its problems, but again, it was seen as a place that people wanted to go to. But really over the last year, we've seen a massive uptick in these online attacks against Indian Americans in a way that has shocked a lot of Indians in America that I speak to, has shocked a lot of people in India as well. Could you tell us a little bit about that? What exactly is going on here? How do you explain this complicated and frankly scary moment in US politics to a lot of people?
I'm glad that you raised that because it's been weighing on me, and I've seen it unfold over past however many months, or 1 year or so. And I think we can diagnose the problem, but then we can also talk about the prescription as well. The diagnosis is a bit murky. Some of it perhaps is a natural backlash to many South Asians and Indian Americans rising in prominence across the country because of the factors we've talked about. The need to step up leads to people stepping up, but then that can sometimes lead to some degree of backlash. Make no mistake, this coarsening of our politics is in part because of the tone that is set by the current administration, which allows, if not fosters, this very, very debased style of discussion. And it's not just been Indian Americans who have suffered. It's also been a number of other ethnic minority groups across the country who have found themselves on the unfortunate end of a lot of attacks. I don't know the extent to which these online attacks actually mirror real sentiment or the extent to which they are just bots that are spewing out nonsense. It's difficult to know. But what matters more than anything is our response. And in a moment of this nature, we as a community of Indians and Indians Americans have two choices. We can retreat or we can step up. If we retreat, then it's possible that the vitriol may go away, but that is effectively handing a victory to our bullies. And that is something that we cannot do. It's something that I will not do. And to me, the only option in the face of these hateful attacks is to step up and assert our ability to lead. And that is in part why I think it's important that Indian Americans of all stripes and all political backgrounds, Republican, Democrat, step up to lead.
Right. Can I ask you just one final question in terms of, your sense of where you are as an Indian American politician? Again, like I said, just to reiterate, because it was what interested me about doing this interview in the first place. Should you win, you will really be the only Indian American governor in office right now, really perhaps only the third in United States history at this point in time. There's often this perception, of course, that good Indian American boys and girls don't necessarily think about getting into politics. It's, I think, maybe a holdover the perception that you have here that good kids don't get into politics. It's seen as a murky and dirty profession. Does that attitude carry over, I think, to Indian Americans as well, which is why we don't see as many of them in politics or participate in politics? Your sense?
I think it does. I admit that I had not weighed that factor before you mentioned it, but now that I give it more thought, I think it does. I think, particularly among Indian Americans, many of us were conditioned to go into one or two fields as the only acceptable fields. And as you noted, politics was considered unseemly or unprofessional in many ways. And that is for two reasons. One is that for the longest time, politics was dirty and was unseemly. This is an opportunity to bring precision and hope to a field that was otherwise previously muddy. But the other thing that I think is important is culturally, at least in the US, my view is that many Indian parents have often viewed a good job as one that was equated to making money. It was not focused on social impact or any kind of impact. The impact was measured by the paycheck. And as you can tell, I think that's completely wrong. And what I think is instructive in this moment, and yet another benefit of my and other Indians stepping up, is that we may inspire other Indian Americans to say to their parents, it's not just about the paycheck that I'm chasing, it's also about impact.
Right. Can I ask you just two or three questions just to close out, which is, again, just a broader setting of America that we find ourselves in at this point in time. You are, of course, like I said, again, a public health professional by training. And, you were mentioning Robert F. Kennedy Jr., who, of course, Indians may not know him extremely well, but is, of course, responsible for the health and safety of the United States as the health secretary of the United States, but of course has carried out policies that many people have looked at askance, including, skeptical questions about whether vaccines really work. And that is something that that people in India are also looking at and saying, wait, this is the United States. This is meant to be the capital of world science and technology. What exactly is going on here? And it seems to be part of this broader trend that we've seen towards irrationality, perhaps even madness in US politics over the last couple of years. Can you explain that setting? Because to a lot of people, what you were mentioning in that conversation is a sense of America seems to have gone off the rails. Could you explain that to people, I guess?
In many senses, that perception is correct. I mean, Shashank, the way that I think about this is, if what has unfolded in American politics over the past 9 years were happening in another country, the way that the American press would cover that is with some of the skeptical questions that you raised. We would say, gosh, what is going on in that country? We thought that country was the beacon of progress. And now they look to be going off the rails and being led by people who don't believe in science and basic truths. And we would cover that through the sometimes deeply skeptical lens that American foreign correspondents cover things of that nature. And yet now it's happening here. And foreign correspondents such as yourself are asking these very tough and appropriate questions. Here's what I think is going on, particularly in the health and public health sector, where we have gone off the rails. There's no doubt about that. In the aftermath of COVID, we never really had a national reckoning about what went well, what didn't go well, and what we would learn for the next time. And that absence of an agreement on the aftermath of COVID has meant that it's up to everybody to weigh in on how they think COVID and other policies went. And into that vacuum of precision in the way that we had after 9/11, into that vacuum have come charlatans of varying degrees, including Secretary Robert Kennedy, who, as you mentioned, runs Health and Human Services. He has used this vacuum, this moment, to peddle his own brand of misinformation and anti-vaccine science. And he's been now given a bullhorn and a perch that allows him to spread these lies far and wide. Make no mistake, they will have real impact for our preparedness and our welfare here in the United States. Already under his watch, at least 2 children have died of measles, something that has not happened in 30 years. And we are less prepared for the next pandemic because of his anti-science views. He should resign. Unfortunately, that's not in the cards right now. And that's why it's so important for governors to step up so that at least states can lead the way.
Right. Could I ask you, just in terms of you mentioning President Trump, his administration, how much of your race, of course, you are running to be governor of a state, but could I ask you how much of your campaign is also running against President Trump and challenging a lot of his agenda?
No, I'm not running against Trump. I'm running for the people of Maine. And what I mean by that is my priorities are about things that are affecting people in Maine today and that are within the purview of the government of the state of Maine to fix. My priorities are to fix housing, to fund healthcare, to feed kids, and to fuel the growth of our economy here in Maine. All of those things are things that have been longstanding problems in Maine and that are within the ability of our state government and our governor to make headway upon. The fact of Donald Trump is a factor that makes all of these things worse. But make no mistake, we have our own challenges. We've had our own challenges even before Donald Trump. What he has done is injected more chaos and confusion into problems that already existed.
Right. And for example, one of those problems might be, as you were saying, economic growth. We know that Donald Trump's tariffs have been extremely controversial. This 50% tariff on India in particular has been deeply controversial in India as well. Could you speak a little bit about that? How that's impacting someone like you who's running to run a US state, how that's impacting livelihoods on the ground in the United States?
The tariffs are certainly one aspect. In an era where affordability, as Mr. Mamdani saw, in an era of affordability being the one thing that is on everyone's mind, anything that raises prices, even a penny, should be something we should be skeptical about because of how critical affordability is. But that's not the only way in which the Trump administration's actions are affecting people. The one that is that really keeps me up at night here have been cuts to one of the health insurance programs that provides care for low-income people in the United States, a program called Medicaid. And Medicaid has been cut by about 800 billion US dollars. And what that means is that many low-income people, including in Maine, will very soon find themselves without health insurance, which will make it much more difficult for them to find care and go to the doctor before they get very sick. That's yet another example of the chaos that the Trump administration is causing that now governors are going to have to pick up and solve.
Right. And, my last question to you, Dr. Shah, is, of course, you've had Kamala Harris, you've had Zohran Mamdani, you have perhaps a Dr. Nirav Shah and Vivek Ramaswamy, of course, running to be governors of their respective states. Like I said, very few people have done what you have done coming from your particular background. Is that daunting at times?
Oh, no, it's just the opposite. It's an opportunity. The essence of American politics, arguably the essence of politics everywhere, is for people who have not done something to take an opportunity to do it. That's one reason why our electoral system is the way it is. And right now in the United States, the mood is for folks with unconventional backgrounds who have different perspectives on longstanding problems to step up and lead. So far from being daunting, it's an opportunity. And what all good leaders crave is an opportunity to do something.
Understood. Dr. Nirav Shah of the state of Maine, running to be governor of that state, running to also be perhaps the only Indian American governor in the United States, joining us here on the Hindustan Times podcast to explain his political journey and, of course, what he is planning to do as governor. Thank you so much, Dr. Shah.
Thank you so much for having me.